Hello friends, myself Dr. Debashish. Today I am going to discuss about the homeopathic medicines for asthma. In homeopathy, the main concept is treat the patient, not the disease. You have to treat the patient. You have to collect all the symptoms of the patient and you have to see which medicines matches with the symptoms of the patient more nicely, and that medicine should be prescribed on the basis of the totality of symptoms. Totality of symptoms consists of mental symptoms, physical symptoms, and modalities. Modalities means aggravation and amelioration. So let us begin. Today I am discussing about 10 important homeopathic medicines which could be used in your clinical practice. It doesn't mean that only these medicines are useful and other medicines are not useful. I can discuss about 50 medicines which are very useful in cases of asthma. But today I am discussing only 10 medicines. So let us start. First medicine is antim tart or antimonium tartaricum. In antim tart, the patient will feel that there is large accumulation of mucus in the chest and there is rattling sound in the chest and there is no expectoration. The rattling sound could be heard all over the room. पेशेंट के जो चेस्ट में है घरघराहट का आवाज होगा, क्वीजिंग साउंड होगा, पेशेंट खांसता है पर वो कुछ भी एक्सपेक्टोरेट नहीं कर पाता है। ये मेन सिम्टम्स है एंटीमटाट का। सेकेंड मेडिसिन जो कि बहुत इंपॉर्टेंट है वो है आर्जेंटम नाइट्रिकम। आर्जेंटम नाइट्रिकम पेशेंट्स मेनली इट इज यूज फॉर नर्वस एज्मा। नर्वस एज्मा मीन्स द पेशेंट कहीं निकलना है या कोई कारण से कुछ ऐसा बैड न्यूज है या कुछ है उसके कारण उसको एज्मा का अटैक आ रहा है। इसमें क्या है, पेशेंट बोलेगा आप दरवाजा खोल दीजिए, खिड़की खोल दीजिए, फैन चला दीजिए। पेशेंट वांट्स कोल्ड एयर and wants doors and windows open. I am not going in much detail about argentum nitricum. You have to understand all these symptoms and you have to see if the patient matches with the symptoms of argentum nitricum. Then only you prescribe argentum nitricum. Third medicine, which is arsenic album. The arsenic album is very much abused in cases of asthma. We find that there are many doctors who prescribe very randomly arsenic album, though arsenic album is not indicated in each and every case of asthma. Don't prescribe it routinely. There are specific symptoms for arsenic album. First of all, the patient is very restless. Second, there is aggravation at night, mainly at midnight, and a patient cannot lie down. There is much anxiety, fear of death. Then there is thirst for small quantity of water. If you find all these symptoms, you can prescribe arsenicum album. Fourth medicine is cuprum metallicum. In cuprum metallicum, you will find that spasmodic character of the cough is very much manifested. If there is much spasm and all symptoms are there, then you can go for cuprum metallicum. Fifth medicine is ferrum metallicum. Ferrum metallicum is mainly indicated in anemic girls and children who are very much anemic, and you will find that there is an exacerbation of the symptoms at about 12 o'clock at night. Sixth medicine is lachesis. In lachesis, the patient will wake up at the night and there is aggravation from the sleep, and after going to sleep the patient wakes up and he complains that there is much distress in breathing and patient feels a lots of problem. Other symptoms of lachesis should also go in par with the while selecting lachesis. For example, the patient should be suspicious, there should be loquacity should be present, and other symptoms of lachesis, general symptoms should call for lachesis. Then seventh medicine is Grindelia. In Grindelia, the patient is somewhat like lachesis, only he wakes up at the night and there is much distress in the breathing, and he wakes up at the mid of the night and he coughs up mucus, and all those symptoms are there in Grindelia. Then eighth number is ipecac. Ipecac, there is much wheezing and rattling of mucus, especially in children. You can use ipecac. as well as there is nausea or vomiting, and all the symptoms might be there. Clean tongue should be there. Patient should be thirstless. If you find all these symptoms, then you can prescribe ipecac. Ipecac might be followed by arsenicum album if the symptoms agree. Ninth is calibichrome. Calibichrome has specific aggravation at midnight, after midnight, that is 2 to 4 a.m. Other calis like calicarb and other calis also have that time, but in calibichrome there is marked stringy mucus, and that is yellowish in color. All this should be there. Then you can prescribe calibi. Then natrum sulph. Natrum sulph is a medicine we will can prescribe in the children or in the aged people who have, when there is any change of weather. For example, it is a patient is maintaining well, but all of a sudden it starts raining, and there is sudden drop in temperature and all. The patient has much wheezing and rattling of the cup, and all those is there. Especially there is morning aggravation and all is there, then you can prescribe natrum sulph. Thank you. Thanks for watching. If you like my video, please do subscribe my channel. Thanks.